This is an X-ray of a 4-year-old girl child who gets frequent fractures at multiple sites. She is admitted now for administration of a drug which she used to get every 3 months. Now, before we proceed with the answer of the quiz, we'll have a discussion on the clinical approach of a frequent fracture in a child. Frequent fracture can occur in an adult or a child in two scenarios. One, the bone is normal. But the fractures occur because of environmental reasons. An accident-prone person getting injury, fracture, fall repeatedly and sustained fracture. Nothing wrong with the bone. A similar situation can occur in a child. We need to consider battered baby syndrome. The other situation is there's something wrong with the bone. That again can be generalized basis. The fracture is occurring at multiple sites, or the fracture occurring in a localized manner. The repeatedly fracture is occurring in one site only. The fracture can occur in a later age group. Initial childhood days or youth may be normal. In such a situation, we consider acquired reasons for the fracture, but that's not the rule. Sometimes inherited disorders also can have a presentation late. Few of these milder varieties of inherited disorders and few of the local pathologies also of inherited nature can have an onset of the fractures like this at a little age, older age group. If it is an early age group, younger age group, we need to consider the inherited disorders. In an adult, there are two scenarios. One is generalized, the fracture occurring in multiple sites. Commonest reason is osteoporosis, especially in a geriatric age group or even a little younger who are already having long duration battered and nutritional problems, especially vitamin D, and we need to consider this generalized osteoporosis. If it is occurring on a localized basis, fracture occurring in one site only, then again in an older age group we need to consider local pathologies, especially secondary deposits in the bone, other lesions, sometimes cystic disorders, many other problems also sometimes in an older age group. In a child, when it is occurring in a generalized basis, multiple sites fractures, we need to consider osteogenesis imperfecta. Previously it was 4 types. The classical one, type 1 is a mild variety, type 2 autosomal recessive, very severe variety where the fractures can occur even in a fetus, in the newborn, multiple fractures. So they may not survive at all, very early death occur. And with the advance of the diagnosis, the classification, there are 19 varieties, 5 and 6 pathological, and from 7 to around 19 types are the genetically features are the suggestive. We don't know much about the clinical symptoms, different varieties are there. And this is one of the situations where it's not a generalized disorder. It's a fibrous dysplasia of the bone, the localized pathologies, and some of these problems can involve the skull, and fibrous dysplasia is a different entity, a localized fracture. Now, how to approach a case of the multiple fractures? First of all, you need to assess the severity. Is it out of proportional severity? If not, consider the battered baby syndrome. And if it is so out of proportional severity, first question is it a normal child, bedridden child, cerebral palsy, development delay? In such situations, you get many of the cases bone thin and fractures, and a few of the situations can be deficiency of vitamin D and vitamin C, can be scurvy, can be rickets. There are eminently treatable entities also we need to consider, especially in a bedridden child. Other part of the history, you need to consider the past history, the details of the fracture from which age onwards the fracture was noticed in utero, perineal period, that indicates the severe forms. There can be a normal child in the first year once they start walking and frequent falls sustained, the milder forms, type 1. And few of them are very mild and can be onset a little later also. We need to consider in dental problems the details of the fracture, which all sites are involved, which is involved in the vertebral body, limbs, all the details in the past history. And family history need to consider the consanguinity, other members in the family. One very important point when we consider the pedigree chart is to consider the spectrum of the disorder. It's not a fracture of the bones only. The triad is the blue sclera, deafness, and the dental involvement. So if you have the milder involvement in the case of members, other members, you may get this involvement but no fractures. So unless you ask for that, if you ask for fracture only, you may miss that during the pedigree chart construction. You need to consider this triad. And in a clinical scenario, sometimes you may do the investigation, come back again for the history and clinical evaluation. This is one of the situations like this. So what is the most important investigation? Of course, the imaging, X-ray. X-ray, there are two very, very important situations where eminently treatable conditions like rickets and scurvy, both will give classical radiological findings. Then, if suggestive of these two entities, you can confirm by the biochemical test, that is enough. But the radiological examination doesn't support these two entities. Bone density is low and the X-ray shows multiple fractures, healed and active. We need to consider this entity. The very same situation where the demineralization is not there in a battered baby syndrome, again there are features which may be arguing for the battered baby syndrome. When the bone density is less, you need to come back again and check the eyes, check the ear, hearing and other part of the skeleton. And of course, go back and revise the clinical findings and assess the teeth also. Sometimes the teeth is dendrogenesis imperfecta, amylogenesis imperfecta. So the enamels can be involved, sometimes the tendon can be involved. And it's all the more reason when the treatment with bisphosphonates, there can be an involvement of mandible and necrosis. That way also evaluation of teeth is very important. Final confirmation of the entities by genetic studies. And they finally come to the answer of the question. In this case, there is a fracture of the upper end of the femur. The bending of this femur is evident. It may be multiple times fracture and it's a healed fracture. So what about the other part of the question? Lower end of the femur and upper of the tibia, there are different lines. These lines actually represent the administration of bisphosphonates. So there is no curative treatment for this entity, but sometimes you can treat with bisphosphonates and the administration and lead to a little bit of mineralization. The lines represent those administration of bisphosphonates. Thank you.